start and then.
Thanks, Trini. Good morning, everybody. So nice to get to meet all of you virtually this morning. So today we're going to be talking about the landscape of the New Hampshire Anti-Hunger Network and what we're doing in New Hampshire around food insecurity. So our system and nutrition supports is kind of like a power grid, or sometimes people think of it as Wi-Fi and internet access in the country or in New Hampshire. And that it works like it moves healthy food to households. And in New Hampshire, the grid is well developed in some areas and patchy or non-existent in others. So in some places we have really good access, and in other places we don't have good access at all. So what is that system of food and nutrition supports? It's SNAP, it's school meals, summer meal programs, the child, adult, and care and food programs, and the WIC program. And these are the federal nutrition programs that are provided to us to be able to give people the access to the nutrition supports that they need in order to have more equitable access to healthy foods. So New Hampshire has low participation in our federal nutrition programs, and at New Hampshire Hunger Solutions, we recognize this as a strategy, an area where we could improve access to those nutrition supports. We are 47th in school breakfast participation. That means that the way we measure that is for every 100 free and reduced eligible students participating in school lunch, we would like to see 70 free and reduced eligible students participating in school breakfast. New Hampshire serves about 45.6 students who are eligible for free and reduced breakfast. So instead of 70. We are 39th in SNAP, which means that we miss about 18% of our residents in New Hampshire that are eligible but not enrolled. And we do even worse with our residents that are over 60. We miss 60% who are eligible but not enrolled. We are 32nd in the child and adult care food program. We're 25th in the summer meals program. And with the summer meals program, I think we miss like about 7,900 students or children between 0 and 18 who are eligible but don't participate in summer meals each summer. WIC serves only 44% of those who are eligible. And again, SNAP serves only 40% of those eligible older adults. And food insecurity is on the rise in New Hampshire. Recently, we had about almost 85,000 households that said they didn't have enough food. And that's been an increase of 30,000 households since September. And 200,000 households said that they had difficulty paying for usual household expenses. New Hampshire is such a small state, 200,000 households is a large part of our population, with only having a little over 1 million people in our state. So to foster the health and well-being of our New Hampshire residents, we need to make sure more communities are plugged into the grid so that everyone who's eligible food and nutrition support receives it. So the focus of our work is to increase school meal participation. Right now, we have a focus on Manchester and Nashua, but we plan on expanding that to be more statewide. Our second focus is to increase participation in SNAP and other federal nutrition programs through state advocacy and legislative change. We know we need to increase public awareness around food insecurity and hunger and the barriers to access, as well as, and to better understand all these things, we need to have data collection, and to improve public awareness, we need to have better communication campaigns. And our fourth focus is coalition building for existing and emerging food access coalitions. And that I'm going to then pass it over to my colleague, TIffany Dodier.
Good morning, everybody. So of course, the New Hampshire Hunger Solutions is just one piece of the anti-hunger network in New Hampshire. So we wanted to talk specifically about coalitions that already exist in New Hampshire and how also New Hampshire Hunger Solutions is supporting those coalitions and that work. And so the statewide coalition that we help coordinate and co-facilitate is the New Hampshire Food Access Coalition. This was created in 2020 to fill the need for a organization or group of individuals that was supporting the food access policy in New Hampshire. And previously, New Hampshire Hunger Solutions was still building capacity, and they just had brought on their executive director, and later in that same year hired Jessica as the deputy director. So they were building capacity, but you still need that connected system of organizations because Hunger Solutions can't do all this advocacy on their own as well. So this network of stakeholders across the food system is super important for the things that we envision and the things that we strive to do, which is to engage and connect across the state, educate people about hunger and its causes. And the education really needs to have this same front and the same messaging so that we're talking about hunger in a way that is understandable for all. So we gave that grid metaphor that helps folks understand that this is a systemic issue, collaborate to address the root causes of hunger in our state, and then also build power among leaders and communities to advocate for equitable access to nutritious, sustainable, and local food. So that's a big part of what we're looking to do, and some policy updates that I'll give later today too. So some of these activities I mentioned, so we do meet monthly. So if you're interested, I'll have my contact information at the end, but we meet monthly at these meetings. We learn about other anti-hunger activities in the state, and we have agenda items for other groups across the state, including data collection and policy, and other presentations of groups across the state. We collaborate in subgroups. Almost every meeting we try and create space so that people can connect on a one-on-one basis or a small group basis. Building power, so we have different advocacy opportunities. We send out action alerts. We also provide different skills and education about advocacy so that our partners feel confident that when they're talking to legislators, they know what they're speaking about, and that it's a clear message for them. And along that line, we seek to educate as well. So we give our partners those tools to be able to educate in the language that is easy for other folks not in this work to understand. And as part of that work, we strive to bring in, as I mentioned, partners from all across the state. And so far, these are the partnerships that we've made across the state. And this is really kind of the landscape that we're looking at as far as we know. And this is where you all come in, about people doing anti-hunger work across the state. So we come to groups like this with the intention of also finding more people. And although your organization might not be super focused on anti-hunger work, we'd love to add more folks to this list that would like to partner in all of that. So I just want to point to some important statewide groups as well. A huge partner of ours is the New Hampshire Food Alliance. They have a much more agricultural focus and climate action. So if those are parts that you're interested in, they're a great group to connect with. And they also have climate action teams and ag focus, as I mentioned. They have a statewide meeting each year. This year it will be in May. So that's another great way to connect into this work. There is just a research group that is starting to form. And so that's kind of adding it as a subgroup, as well as a group that focuses specifically on SNAP, participation and enrollment in the state, which is pursuing some legislation and working with our state agencies to make even agency policy change. And then we've strived to, like I said, identify different groups across the state that also are doing this anti-hunger work. So you can see a rather extensive list, and some of that is organizations that have existed well beyond us, and some of them we're helping to develop into further, like the Manchester Food Collaborative is something that is a huge initiative that we're a big part of trying to support that work to develop further. And with that, there is one to add to it as a new subgroup to the New Hampshire Food Access Coalition. So I will go ahead and pass it back to Jessica to talk about this exciting opportunity.
Yeah, so I was so excited to hear all the people here today that I think would be great partners for us to work on this next project or subgroup of the New Hampshire Food Access Coalition, which is creating a state action plan to improve nutrition equity. New Hampshire Hunger Solutions, in partnerships with the DHHS Department of Public Health's Chronic Disease Division, wrote a grant to write a state action plan for improving nutrition equity. The state action plan is going to be developed and implemented collaboratively. So we're looking for anybody who is interested in participating. If you can put your name in the chat, or Tiffany, if you can add my email in the chat, you can email me and we can add you to the email list. Our first meeting is going to be February 28th from 1 to 3. We'll have a 2-hour meeting, and what we'll be doing is looking at where all of the priorities and strategic plans around the state are aligning, where they address food insecurity, poverty, and social determinants of health. So we're looking to really take that systems approach around the state to create the state action plan. We are also working with Trini on this, and she is going to be working with us as a consultant to make sure that we're keeping equity at the center of all of the work we're doing in creating the state action plan. The second part of it is we will be working with our partners that have been on the ground working to expand the implementation of social determinants of health screening in healthcare organizations. But we're also hoping to work with more partners like you on how to, and direct service providers, how do we expand that implementation of social determinants of health screenings at pantries, at other direct service organizations. And working with that, we would be working with the software company Unitas, which is a referral software program, which provides closed loop referrals in order to connect a person to the exact services they need based on their social determinants of health screening, and then send that, with their consent, send a message to the referred provider, letting them know that they have somebody they need to connect with, and that provider can then reach out to the client as well. So completely closed loop and wraps around that person to make sure they're getting the services that they need. And then we will be working to train regional food access coalitions and healthcare organizations on SNAP enrollment, on how to be more culturally effective, and on Unitas and how to use the referral software, how to be onboarded and how to use it effectively within your organization. And Unitas is also working with the Department of Health and Human Services Chronic Disease Division. So we are so really excited about this opportunity and the project, and we are just getting ready to send out our invites today. So if you're interested, if you send me your email, we can add you to the email list. I will be on vacation starting this afternoon, but Tiffany, Laura Milliken, our executive director, Scott Foster with the Division of Public Health and Community Services, Chronic Disease Division, they'll all be available this week to meet with anybody and chat with them about the spine project.
And I did want to throw in there too a point of interest for all of those about that state action plan to improve nutrition equity. Although the focus is nutrition equity, that Unitas software will refer to all kinds of different providers. So their biggest provider in the Unitas system right now is those that I believe for substance use is their biggest database of provider in the Unitas system right now. So we're looking to make sure that is an even blanket across all services, but that's something that I think that this group especially would be very interested in connecting through too. So we'll take your questions right now if you have any.
So, excuse me. Thank you, Jessica. Thank you so much. We usually invite people to just come on off mute and ask your question if you're interested. You can also type it in the chat and we'll read it aloud for you.
Hey guys, Mike from United Way. I had a quick question about Unite Us. what would you see as the similarities, differences, and overlaps between Unite Us as a platform and 211?
So they are very similar, except for that when you call 211, you are given the information and a list of phone numbers to call. But in Unite Us, the person is also able to be called by the service organization that they're being referred to. So they have their information is shared. Also, within Unite Us, there's opportunities to upload documentation and paperwork so that it reduces that paperwork burden for clients and patients. So that's another benefit of the program. But Mike, also to your point, 211 and Unite Us are having conversations and partnering and figuring out how to get all of that information from 211 and onboard those agencies into Unite Us. So there's that partnership there between the two. And so now if somebody calls 211 with the client's consent, 211 can also do the referrals out to the direct service providers.
Jessica, this is Tori Jennison, and I have worked with Unite Us before with the IDNs, and I think one of the other really important differences is the ability to communicate back and forth about that referral. Whoever makes the referral can see if it was followed up on. Whoever receives the referral can see who else is involved in that client's care and that client's team. So it's a much more robust ability to begin to create a vision of a community care team around someone. That 211 is fantastic at that initial contact assessment and referral, but the ongoing management of the referral is really a key difference.
Absolutely. Thank you, Tori, for bringing that up. Great point.
Another awesome feature of that system too is that when a client shows up with a bunch of documents, you can scan them into that system with their permission, and you can share it across their care team so that every time that they're going, they don't have to bring all of this documentation every time, and it can send directly to individuals that they're being referred to, and cut across that barrier for them.
And they'll be working with us to set up trainings all around the state, and they will work with organizations one-on-one for training and onboarding and to really fully understand, because it is a really robust software that does really amazing work.
Great. Any more questions?
I had a quick question. Do you all follow issues related to the location of grocery stores?
Yes, we look at a lot at low income, low access in regions to understand where people have access to those nutrition supports and where they don't. And then also where that aligns with, the occurrence of chronic disease in populations as well.
I'll follow up with you. I heard a rumor that the Store Street Market Basket in Concord might be closing, and I was concerned about that.
Oh, okay. Yeah, definitely.
Just a rumor.
That's too bad. I'd always hoped that grocery store would expand into the space next to it and become a bigger store.
Well, I think you've put your contact. Yep, your contact information is in the chat. We will also provide out the presentation, so people who were not able to join us today have access to that. And I just want to thank both Jessica and TIffany for sharing all of this great information and making the connection around food access and food equity for this group. So if there aren't any further questions, we'll move on with thank yous. Okay.